NHS together is its staff. And the next speaker has been holding things together for years on the front line, and we're eternally grateful that he is here on our platform, and he is a fantastic consultant, loved by his patients who he couldn't do enough for. So let's have a big hand for one of our wonderful frontline hospital consultants, Dr. Gurjinder Sandhu, or as we call him, Gurj.
Thanks very much for that, Eve. Now, just as John said, just as the sun came up this morning, winter came around this year. Influenza, colds, pneumonias, falls, it was all expected. They told you that we were better prepared than ever before. That's not how it felt in the hospitals. I'm used to going home in winter and seeing 7 or 8 ambulances parked outside Ealing Hospital. This winter, I came in the morning and I would find 7 or 8 ambulances parked outside Ealing Hospital. I'd walk through the hospital and I would see a look in the eyes of the nurse in charge. Your wife, Chris, inevitably. And that look was devastating to see in an experienced nurse's eyes. That look said, I am exhausted. That look said, I don't know how I survived this night. That look said, I can't keep doing this. And all you could do was give her a hug, tell her she'd done her best, tell her she'd done me proud, and try to get her home. But sadly, I know that that nurse would go home, despite all of her efforts that night, and feel that she hadn't done her best because of circumstances that were not under her control. So I would go on to that shift that day, and we would still have the ambulances lined upstairs. There would not be a horizontal space in the hospital for us to examine a patient in the emergency department. You would start a run around the hospital trying to get patients out of the hospital so you could get more patients in. You will start identifying the sickest patients in that emergency department and ensuring that they are safe. You will be in situations in the resuscitation department where you may need to intubate and ventilate a patient without having an ITU bed to send that patient to, and keep a doctor and a nurse by that patient's side to keep them safe. Do not get me wrong, we will keep you safe, no matter what they do. But please, let those staff not go home and feel that they've done something wrong. Those staff are working their damnedest to make sure that the hospital and the patients are kept safe. I am proud of those nurses, but I am also proud of the junior doctors. You will hear from Ashlyn a little bit later on. When I was a junior doctor, we only had to look after the patients. Now, junior doctors find themselves in a situation where they are battling with the government, they are battling with the health secretary, they are battling with the politics of everything, and they are still looking after the patients with love and compassion. And at such a young age, to have that burden on your shoulders and to take on that fight is truly admirable. And those junior doctors keep the hospitals safe 24/7. We have a 7-day working hospitals around the country with people who are putting blood, sweat and tears. And do you know what? They're doing it with, despite all the circumstances, with a smile on their face. They are doing it and keeping rapport with those patients. They are doing it and uplifting the spirits of those patients, despite their own morale and spirits being in their boots. Quite frequently, It is the elderly and the frail patients over winter that give us our greatest challenges. I have been a physician for 18 years, and for 8 of them I have been a consultant. And I will say that elderly care medicine is the hardest medicine to practice. And it is shocking that people are trying to create the illusion that elderly patients can quite simply be looked after in their own homes and do not need hospital facilities, do not need accident and emergency departments. Let me give an example. A passerby walks by an elderly man who's in the rain during the day, and he looks a little lost. And the passerby asks what's going on. He goes, "No, I'm fine. I'm just making my way home, don't worry." 5 hours later, they pass by again and find the same elderly gentleman in the same place, still looking lost in the rain. And that kind stranger calls an ambulance because they really know that this gentleman is confused and they do not know what's going on where they live, and they cannot leave this man in the rain anymore. This gentleman will be brought into the accident and emergency department, and that team of nurses and doctors will begin the detective work. We've got 4 hours to do it. We're going to get him out in 4 hours? No, we're not. We're not going to get him back out. We've got to keep him in hospital. We've got to do investigations. We've got to do scans. We've got to look for infections. We need to establish whether this gentleman has dementia. We need to establish who this gentleman is. We need to find people. That admission becomes a 3-day admission, a 4-day admission, a 5-day admission. As we start building information up, we start thinking about, is it safe for him to go home? And that's where another group of staff come in that are really undervalued in the NHS, and that is our therapy staff, our physiotherapists, our occupational therapists, and our social workers as well. Because let us not forget that we are not just practicing medicine in an emergency care crisis, we are practicing medicine in a social care crisis.
True.
Our therapists will have established who he is, who the neighbours are, who the next of kin is, who is the GP. They will have put in pendants, they will have put in alarms, they will have put in a safety net. Not only are people keeping you safe in an emergency department, they are trying their damnedest to keep you safe when you leave hospital. Do not underestimate what these staff do. And what's sad, and I think I will speak more for Ealing Hospital, is what is sad is that this staff group is being told that they are not needed. They are not needed. We do not need an Ealing Hospital. We do not need a Charing Cross Hospital. All of these patients will be looked after in the community. These staff have been working under an axe placed over their heads since 2012, an axe that has come down and cut off our paediatric department, an axe that has come down and cut off our maternity department, an axe that has meant we have watched our friends and colleagues leave because they have not felt that they could continue to watch services being destroyed in a hospital that they have spent their working careers building up. We are now in a situation where even our admin staff are being told that their grades will be downgraded, their jobs will be downgraded. And talking to one of those admin staff, it becomes very clear the word she used to describe that situation was humiliation. When you have given your all to a career, when you have given your all to a profession, and somebody tells you you're not needed, when you know you are doing work where you are needed. The irony during all of this is, when we look at ambulance redirections in London, Ealing Hospital, month after month after month, has more ambulances redirected to it than any other hospital in London. How do you tell that staff that they are not needed. Let's look at a little more details of these plans. John mentioned earlier on NHS improvement, and suddenly people starting to say, well, do you know what? Maybe we need to look at our accident and emergency activity a little bit more. McKinsey's and all of those fancy management consultants took their millions over the years, and they tried to say, well, let's see what would happen if we cut out Ealing Hospital. What would we need to do it? Well, we would need to reduce the number of admissions by about 30–40%, and we actually think, looking at our numbers, that we've got 1,000 extra beds in northwest London that we don't need. So in that time period, what has happened? Every winter in northwest London, we've had to open an extra 200 beds to keep things going. And steadily, the trend of beds in northwest London has been going upwards. The number of admissions in northwest London has been going upwards. You close 2 emergency departments, you take 2 assessment areas out, you put pressure on the surrounding hospitals, and one by one, like a domino effect, first you see Northwick Park's A&E performance deteriorate, next you see Hillingdon's A&E performance deteriorate, next you see Ealing's A&E performance deteriorate. You see performance deteriorating in outer West London, and yet people still say, that's the hospital we think we can close. The one where more ambulances are redirected than anywhere else. You can probably guess, I like numbers, I like graphs. I like graphs because they speak the truth. Graphs are evidence. Now there's one graph that really makes me panic, and that was when the Dow Jones crashes. Now, I probably don't fit the profile of someone that has lots of stocks and shares, so why do I panic when the Dow Jones crashes? Well, in 2008 we had a financial crisis, and after that we have had top-down reconfigurations in health like you could never imagine. CCGs, Health and Social Care Act, STPs, accountable care organisations, constantly trying to change things because we cannot afford to look after our elderly. That is the message that this government is sending out. An elderly population that has given more in taxes than anyone else to this National Health Service deserves to have this National Health Service look after them when they need it the most. With accountable care organisations, I used to think we're talking about robbing Peter to pay Paul. But actually, we're robbing Peter and we're robbing Paul and we're paying Richard. That would be Branson. We're robbing Peter and we're robbing Paul and we're paying Donald. That would be Trump. This is a way in which the private sector will come along, and as John says, these shysters will try their best to make sure that the NHS is financially bankrupt. But we will ensure that nobody ever allows the NHS to be morally bankrupt. We... Where there is injustice in the magnitude that we experience, there is never the possibility of walking away from a fight. And that is why I am so proud that you guys continue to fill halls, continue to leave these events standing room only. Thank you very much for all your support. It means so much to the staff.